Hello and welcome to Renova Clinic. If you are thinking about full mouth dental implants, this video may help you avoid one of the most common mistakes patients make before choosing their treatment. If you are thinking about full mouth dental implants, this video may help you avoid one of the most common mistakes patients make before choosing their treatment. You have probably asked yourself, do I need only 4 implants or are 6 implants better? The truth is, this question alone can be misleading. Not every all-on-4 treatment is weak, and not every all-on-6 treatment is automatically better. And not every all-on-6 treatment is automatically better. The success of your treatment does not depend only on the number of implants. It depends on where they are placed, their angle, your bone quality, the design of the bridge, and how chewing forces are distributed. In full arch implant treatment, we do not place one implant for every missing tooth. Instead, we support a full fixed bridge with several implants. Sometimes 4 implants are enough, sometimes 6 are better, and sometimes a different plan is needed depending on the patient. All-on-4 means a full arch bridge is supported by 4 dental implants. In many cases, the back implants are placed at an angle to avoid sensitive areas, such as the sinus in the upper jaw or the nerve in the lower jaw. All-on-4 can be an excellent option when the bone is suitable. The implants are positioned correctly, the bite is balanced, and the bridge is designed carefully. It can work very well when the case is planned properly. All-on-6 means using 6 implants to support the full arch bridge. The additional implants may help distribute chewing forces more evenly, especially in certain cases such as the upper jaw or when stronger support is needed. But I want you to pay very close attention to this next point. 2 extra implants do not automatically mean a better result. 6 implants placed in poor positions may perform worse than 4 implants placed with excellent planning. This is one of the most important points patients must understand. The number matters, but the planning matters more. When dental implants fail, it is rarely because of one single reason. It may be related to inflammation around the implants, poor bone quality, smoking, uncontrolled diabetes, teeth grinding, poor bite distribution, or a bridge design that is difficult to clean. So when a patient asks, are 4 implants enough for a full jaw? The answer is sometimes yes and sometimes no. For some patients, 4 well-planned implants can provide excellent support and long-term stability. For some patients, 4 well-planned implants can provide excellent support and long-term stability. For other patients, 6 implants or a different treatment plan may be necessary. The lower jaw often has denser bone than the upper jaw. The upper jaw may have softer bone, and the sinus area can affect implant positioning. This is why, in some upper jaw cases, we may prefer additional support, such as all-on-6, if the patient's anatomy allows it. Now, another common question is, does all-on-6 last longer than all-on-4? The answer to that question is not necessarily. Longevity does not depend only on the number of implants. It depends on diagnosis, surgical quality, bridge material, bite balance, daily cleaning, and regular follow-up visits. Dental implants can last for many years with proper care, but no treatment should be considered maintenance-free. One of the most important details patients often do not see is the design of the bridge. Is it easy to clean? Is it easy to clean? Is there enough hygienic space under the teeth? Are chewing forces distributed properly? Are the back teeth too long and creating extra pressure? These details can make the difference between long-term success and early complications. The biggest mistake is choosing treatment based only on price or the number of implants. A patient may say, this clinic offers me 6 implants for less money, so it must be better. Not always. The real questions you should be asking are as follows. Who planned the case? What type of 3D scan was used? What bridge material is planned? Who designs the bridge? And how will the bite be adjusted? At Renova Clinic, we do not start with the question, do you want 4 or 6 implants? We start with a more important question. What does your case need so you can eat, smile, speak, and clean your teeth comfortably after treatment? Before deciding between all-on-4 and all-on-6, we usually need a 3D scan, bone density evaluation, gum assessment, medical history review, bite analysis, smile evaluation, and a clear plan for the final bridge. Another question patients ask is, can I get fixed teeth on the same day? In some cases, yes. Temporary fixed teeth can sometimes be placed on the same day or shortly after surgery. But this is not suitable for every patient. It depends on the stability of the implants during surgery, the condition of the bone, the presence of infection, and the doctor's treatment plan. Many patients think the teeth they receive at the beginning are the final result. In many full arch cases, the first set is temporary. It helps with appearance and function during healing. After the implants integrate with the bone, the final bridge can be designed with greater precision. Even if the implants are excellent, problems can begin if the bridge is not easy to clean. Bacteria around implants may cause inflammation. And if this progresses, it can lead to bone loss around the implants. This is why a good implant bridge must be strong, beautiful, and cleanable. We may prefer all-on-6 when the case needs stronger force distribution, when the span is longer, when we want to reduce stress on each implant, or in certain upper jaw cases. But this decision must come from diagnosis, not from advertising. All-on-4 may be enough when the implant distribution is excellent, the bone is suitable, the final bridge is well designed, and the patient is committed to cleaning and follow-up. In this situation, we do not add implants just to say the number is higher. So, should you choose all-on-4 or all-on-6? The real answer is, choose the plan that fits your bone, your bite, your smile, your health, and your lifestyle. There is no single solution for every patient. If you feel confused or afraid before full-mouth dental implants, that is completely normal. It is a big decision, and you deserve a clear explanation. Do not rely only on before and after photos. Ask about the treatment plan. Ask about the bridge material. Ask about the cleaning design. Ask about the bite adjustment. And ask about the follow-up process. At Renova Clinic, we can evaluate your case remotely using mouth photos and x-rays if available. Then we can explain which options may be suitable for you, all-on-4, all-on-6, or another personalized treatment plan. Write in the comments, were you told you need 4 implants or 6 implants? And subscribe for more clear dental education, because your smile deserves the right decision, not the fastest one.